What is a liver? What are the functions of a liver? When does a liver function well? And what are the contraventions to its effectiveness? As promised, a medical practitioner is here with me in the studio to speak to these questions and lots more concerns you may have. In addition, in order to give you a panoramic understanding of this vital organ, as done the other time, I shall first bring you a detailed report on this body cleaner, as I call it. On that note, I say welcome to Talking Health with Bumi, your authoritative show on health and wellness.
The liver is the largest organ and gland in the human body and one of the most vital parts, playing a crucial role in various psychological processes. It is located in the upper right division of the abdominal cavity, below the diaphragm and above the stomach, right kidney and intestines. The liver is divided into two main lobes, the right lobe being significantly larger than the left. Each lobe is further divided into smaller lobules, which are the functional units of the liver. In adults, the liver weighs approximately 1.4 to 1.6 kilograms and extends approximately from the right fifth rib to the lower border of the rib cage. The liver performs over 500 essential functions, including metabolism, detoxification, bile production, storage, and immune function. It is in the liver that carbohydrate, lipid, and protein metabolisms take place. That is, it is in this organ that excess glucose is converted into glycogen for storage. Fat stored, regulated, and clotting factors such as albumin are also produced. The liver is responsible for the removal of toxins and alcohol from the bloodstream and converts harmful substances into less toxic forms to facilitate excretion. The production of bile, which is essential for the absorption of fats in the small intestines, also takes place in the liver. The liver is also responsible for the storage of essential nutrients such as vitamins A, D, E, K, and B12, as well as minerals like iron and copper. That is not all. This organ also acts as part of the immune system by removing pathogens and worn out cells from the blood. But there are many factors that could cause this vital body organ to misbehave, and primarily these include infections, alcohol consumption, genetic disorders, autoimmune diseases, metabolic disorders, circulatory issues, medications, and toxins. These conditions may then cause such common liver diseases such as different types of hepatitis, cirrhosis, non-alcoholic fatty disease, and liver cancer. But there's light at the end of the tunnel with advancement in medical research. Such include liver regeneration and stem cell therapy for repairing liver damage, precision medicine, non-invasive diagnostic techniques, and immunotherapy. Having seen that the liver is a multifaceted organ essential for maintaining overall health, it is important, therefore, to understand its functions and be intentional about preventing any liver-related disease. After all, prevention is better and cheaper than cure.
Welcome back. With me in the studio to speak more to that report you just watched is Dr. Adaora Enyi, popularly known as the digital physician. If this is your first time meeting Dr. Enyi, I'm happy to introduce you to an accomplished oncologist, co-founder and chief operating officer at Oncopady Technologies Limited, a digital health innovation company here in Lagos. Also, she serves as the director of innovation at Pearl Oncology Specialist Hospital, a comprehensive research and digital women cancer center. Outstanding contributions have earned her much recognition from global brands such as the US Astella Oncology, MTN Nigeria, Microsoft for Africa, Leap Africa, and the list goes on. So welcome to our studio, Dr. Adaora. It's nice to see you again.
Thank you so much, Mrs. Bumi. It's always a pleasure to be here with you.
Thank you for honoring our invitation. Now, without much ado, by the reports we have shown, we have seen what a liver is. Now, enlighten our viewers, what are the functions of a liver?
So for the functions of a liver, we like to categorize it into 5 things. So the first one, which is almost the most important and almost the most common, is that the liver is used for detoxification, right? So the liver absorbs, all of the toxins and expels all of these toxins out of the body. The second thing is that the liver serves as a storage house, right? So it helps to store essential amino acids and proteins that are responsible for helping you to heal your wounds, your beautiful appearances that you have, right? So the liver helps to do that. The third thing that the liver also helps to do is in the production of what we call the bile, right? So the liver has what we call the bile duct that houses the bile, and the bile is what is responsible for our stool. So you know how your stool looks a certain pale, almost pale yellowish coloration. So the liver is responsible for that. So that bile duct production happens in the liver and is responsible for that. The fourth thing rather that the liver helps to do is with the synthesis of certain proteins. So think of proteins and minerals like your vitamins, right? The liver actually helps in extracting all of these vitamins out of the foods, that you consume. So every food and drink that you consume, the liver will take those essential, proteins and vitamins out of it, and then it can now be moved to other parts of your body that it is needed. And of course, lastly, the liver is an important organ, for expelling of waste products out of the body.
Interesting. So I know that sometimes we've had situations when people will say, oh, this person's liver is not functioning well or is damaged. So when is a liver considered ineffective or damaged?
So I would say that a liver is considered ineffective or damaged when the liver is, one, not helping to get rid of toxins from your body, right? So the liver, by virtue of its organ, the natural functioning of the liver is that it's a detoxification agent. So it helps to remove all the toxins. So, we eat a lot. We eat a lot of things, right? And so the liver is that organ that will help to tell the body to separate, what is good from what is bad. So when you are not able to excrete, properly, right? When probably you're having abdominal pain, you're having nausea and vomiting, you're having some yellowish discoloration of your eyes, you are having bloatedness, right? You want to pass stool, but your stool is a different color, right? Then your liver is not functioning, properly, right? Because your liver is not able to actually excrete those toxins that normally you should excrete from the body. Then, of course, your liver is not functioning properly when you have little cuts on your hand and you're not healing properly, right? So remember those essential, clotting profiles and proteins that the liver should actually help to build up, right? Your liver is not doing all of that.
Oh, okay. So what are these common causes? What are the common causes of this damage?
So I would say that the common causes of liver diseases in general, so we'll start with the most common causes. The most common causes are of viral origins. So you look at things like hepatitis A, hepatitis B, or hepatitis C, right? Hepatitis A and B being very, prevalent in African regions.
Do you want to speak a bit to that?
Okay, so hepatitis A and B, they are caused by the viral agents hepatitis A and B, right? And so typically what they do is they are transmitted via either sexual interaction or oral fecal. So oral fecal means eating of contaminated foods, eating of foods that feces has been deposited in, and so the virus actually moves from that feces into your food. And so it can be contacted any of those two ways, right? So it's of viral origin. But the only good thing about viral origin is that anything viral has a lifespan and would eventually, be cleared out of your system. It's now the overwhelming or repeated reinfection, right, that actually ends up damaging your liver. So that's of viral origin. The second most common cause will be medications, right? So there are certain medications that actually destroy the liver. Now, what you want to know is that the liver is like a barrier. That it's like, so when you put things into your mouth, the mouth being the gateway to the body, right? When you put things into your mouth, as it goes down the digestive tract, the liver is that barrier that helps to sieve good from bad, right? So what would happen in this case is that if you take something that originally is already very dangerous to the liver, right? So once it goes in through your mouth, right, it will go in to destroy the liver, right? So if you take like certain toxins or chemicals or medications, that can also affect your liver. I think the third thing, of course, which is very common, and I think this is a clarion call to our men, alcohol. I cannot overemphasize that there is no good benefit of alcohol, right? No matter how much. Some people say, oh, my doctor recommends a glass of red wine.
Yes,
I'm yet to see that doctor that has done that recommendation. But these doctors keep recommending, but we cannot point to the exact doctor that made that recommendation, right?
Google
so
doctor.
Alcohol, exactly, Google doctor. So alcohol is something that actually destroys the liver. And because alcohol releases what we call aflatoxins, right? They actually help to destroy the liver.
Is that not when it's consumed in excess?
So, unfortunately, it took WHO a while, but eventually we now know that there's no safe limit of alcohol. Even a glass of alcohol is detrimental to the liver and detrimental to your brain.
Wow.
So there's no safe limit of alcohol. Then, of course, other causes, of liver disease could include things like your environment, your lifestyle, you not taking your 3 liters of water, as we've recommended, staying hydrated properly, right? Lifestyle things like smoking, use of illicit drugs, right? Substance abuse, agbo jedi. I cannot even overemphasize like the harmful practice that agbo actually.
Some of them are herbs.
Yeah, so they are good herbs and they are bad herbs,
Okay.
right? But when you overconsume these herbal products, right, it actually has an effect on your liver. So all of these can cause liver diseases.
I am the life, the pure many wish they were. I define what premium means to most and still defining. Every royalty asks of me. Dignitaries drink me with no question. I am not loud, so you won't find me in traffic. Seated at momentous ceremonies, luxurious events, and premium parties only. I am exclusive. With an unmissable presence in over 40 countries, I am global. I am the life of every occasion and gathering. I am Nestle Pure Life. Without any introduction, I am the life of the party.
Okay, so many people will be in their homes and they say, oh, my back is aching, oh, my chest. So how do you really know, the symptoms of an ailing liver?
So I think the first and the most common symptom is the yellowish discoloration in the eyes.
Like jaundice?
Like jaundice, what we call jaundice,
Okay.
right? So this yellowish discoloration, spot diagnosis tells you that something is wrong with this person's liver. It can be a cause from, the hepatitis, it can be alcoholic liver cirrhosis, it can be liver cancer, you name it. But once you see a spot diagnosis of yellowish discoloration of the eyes, then you know that this person has a liver problem. Now, remember I said that the liver is also a storage and a synthetic gland that helps, in the production of certain minerals and proteins that help with the skin. So if there is destruction of the liver, then you have itching of the skin. So unexplained itching, you're itching all over your body because
some
ideally
people just have they're what do we call it? They're allergic to a lot of.
so that's atopic dermatitis in that case. But that atopic dermatitis will be as a result of something. So it can be dermatitis either from contact from somebody, so it's contact dermatitis, or atopic dermatitis as a result of, the atopy of that area. So it really just depends, right? But that dermatitis, you would actually see it, and dermatologists can actually spot on, say that, okay, this itching is as a result. There may be like some papular, rashes, some papular, elevations on the skin, and that will give you spot on that this is dermatitis. But in this case, your skin looks almost normal, but you are itching for no reason. So that's a second very common cause that tells us that, okay, this person's liver, there's problem. Then, of course, more evident causes will be things like bloating. So you know that your liver is here, right? And so if your stomach is getting enlarged, what does that tell you? It means that all the food you are getting in, your body, your liver is not able to break it down, and so everything is accumulating in the stomach.
Does that account for men who are becoming pregnant overnight?
Due to alcohol, right? So the alcohol is destroying and staying there in the stomach, and so you have really bloated stomach, and the stomach is getting, and the liver cannot break down as fast as what you are consuming, and so everything gets accumulated there. Just remember that, imagine that this is your digestive tract, a long cylinder, and midway in your digestive tract, that's where the liver is. And so that means that everything that goes in through your mouth must go through the liver. So the liver must sieve what is good and what is bad. Now imagine, I've already said earlier that there's no safe amount of alcohol, and so your body or your liver is struggling to process this alcohol that you've consumed. And so the more you're consuming, the more your stomach is getting bloated. It's taking a longer time, to actually process or break down this alcohol that you're consuming. And so, yes, you can see abdominal bloatedness. Then, of course, more evident, symptoms will be things like nausea, feeling noxious, because, you're taking so much in, your liver is not breaking it down as quickly as it should, and so you feel like you want to throw up, so you're feeling nausea, or sometimes you may actually even end up throwing up.
No.
Yeah.
I see. So, for every disease, doctors like you always encourage us, these are the do's and don'ts. So what are the kind of food somebody, for even if you don't have the disease or ailment, the kind of food you should eat?
So I would say that the kind of food you should eat should just typically be overall healthy foods. So what are the type of healthy foods that are good for your liver? Number one, your fruits and vegetables. You must make sure that every day you take a cup of fruits and vegetables, right? Every day you're eating a salad, you're eating a bowl of, fruits and vegetables, right? So your carrots, your cucumber, your watermelon, right? Your greens, your spinach, your apples, yes. You want to make sure that you're taking your fruits and vegetables. The second thing you want to make sure that you are doing is that you're taking at least 3 liters of water every day. So that water is a cleansing agent that can actually help your liver, right? So it will help to cleanse that digestive tract and make sure that there's no toxin that is left behind, right? So you remember when you use the restroom, you always have to flush with water.
That's right.
Even though the toilet is what is meant for actually moving those wastes away.
Yes.
So that's what the water in your body drinks. So it helps to flush your digestive tract and helps the liver to excrete all of these, waste products out. You also want to make sure that you're taking what we call foods that are rich in omega-3 fatty acids, right? And sources of foods that are rich in what we call omega-3 fatty acids, you're looking at things like your fish. So like your salmon, your Titus, your mackerel, right? Even your hagfish, right? Your kote, your croaker, your catfish. These are sources of rich omega-3 fatty acids. You also want to look at things like your nuts. Now, when I say nuts, I don't mean kuli and granola, because that's the one people are going to pick. No,
granola is not.
So not those type of nuts. So your healthy nuts will be things like your almond, your almond nuts, your chai seed or your flax seeds, right? Those are the type of
Cashew nuts.
No, your bambara nuts, not cashew nuts. So cashew nuts and granola are actually detrimental to the liver because they have what we call aflatoxins that when exposed to the liver, they damage the liver.
Wow.
Yes. So I've actually had patients that actually, as a result of overconsumption of cashew nut, actually do develop jaundice.
Wow.
And then eventually liver damage and then liver cirrhosis. Right? So you don't want granules, you don't want cashew nuts, you want to limit you want to limit all of that.
That is eye-opening,
so
because I consume those
a lot of
like I need nuts in my daily routine.
If you're going to take groundnut and cashew nuts, maybe you just want to take like a very little pinch, maybe once a week. That's fine.
Really?
But your healthy nuts are your almond nuts, your bambara nuts.
I don't even know this bambara thing.
It's an Hausa type of nut but it's really great for the liver, right? And then your chai seed or your flax seed. So those are great sources of food. Then of course you want to make sure that you are not taking any form of alcohol, because as I said, there is not even occasionally, not even a glass cup of alcohol is good for.
Wait there, doctor, because now I'm really interested in this. There are some alcohol that we do at home, we make at home, we brew at home.
And
Those
who has
ones
tested-
that ferment,
has
that get
tested-
fermented by themselves, that we make by ourselves at home.
So the problem with that is that there's nobody that has stayed over the years to test these things over a long period of time to actually prove that these things don't have any detriment.
Really?
However, we have scientists that have stayed over the years to actually test that alcohol is not good for the body. There's no benefit aside from the initial euphoria of about 30 minutes after consumption that it gives you. That's it. Nothing else. Every other thing is bad, bad, bad as it goes.
If someone had told you that there are limits even to your intake of nuts, or you kill your liver, would you have believed? Or if you heard that your constant itchy skin is a possible sign of a dying liver, would you not have said, liar? What about knowing that alcohol, irrespective of the quantity, can 100% destroy your liver? Well, now you know. The question therefore is not, does anyone love you? Rather, do you love yourself? And that's how I draw the curtains on today's edition of Talking Health with Bumi. Should you want to contact us for questions, comments, and sponsorship inquiries, please do not hesitate to call the number scrolling or send a mail to info@kongotv.com. Remember to like, share, and subscribe to constantly get notified when I drop another expose on health. Until I come your way again, think health matters. Think Talking Health with Bumi. Bye for now.